Did you know that 50% of conditions treated at an emergency room could have been treated at an urgent care center? With school soon ending and kids getting even more bumps, falls, and bruises at home or at summer camp, we'd like to share some important information with you for when it's right to go to an urgent care center or an emergency room. Here to tell us more is Dr. Gerry Cvitanovich, Chief Medical Director for MHM Urgent Care. Welcome to the show, Dr. Cvitanovich. Can you tell me a little bit about when somebody should go to an urgent care versus an emergency department?
Well, it's actually a case-by-case situation, but to give you an idea, the things that we see in an urgent care center that a lot of people go to the emergency room for are upper respiratory infections, coughs, colds, flus, lacerations, people cut themselves, sprains, and minor fractures. People think they might have broken their wrist or broken their ankle. We can handle that. Those are some of your good examples of what we could see at an urgent care center.
Can you tell me some other advantages of going to an urgent care versus an emergency department? Well,
a big one, time and convenience. Everybody's time is valuable. And in our urgent care centers, we typically have a door-to-door time, depending on the time of year, anywhere from 35 to about 55 minutes door to door, which means, which compared to the emergency room where your length of stays can be measured in days, not minutes.
Right.
So we are able to get people in and out quickly and respect their time. Additionally, we're located in very convenient locations. And we're open, extended hours. Our centers are all open till either 8 or 9 at night, all open 7 days a week.
Okay. And what kind of services do you actually provide at your urgent care centers?
Our urgent care centers at MHM, we have in-house lab, so we can do our labs right there on the spot. There are some that we may have to send out. We also have in-house X-ray, which is digital X-ray. Additionally, we can sew up lacerations, and we can lance abscesses, take care of things like that.
Sometimes our audience will ask, they'll ask, will they see a real doctor at an urgent care center?
Well, at our centers, we're always staffed with a physician. In some centers that get very busy, we'll have a physician's assistant to help them. But people should expect to see a physician.
Okay, so they'll see a real doctor.
A real doctor, yes. Most of our doctors are, like myself, either emergency room physicians who have done ER medicine for a long time and decide they want to slow down their pace a little bit. Some of our physicians are primary care doctors who wanted to get out, and we have some that are young physicians who finished in family practice who are uniquely qualified to do urgent care, who come work for us straight out of residency.
That's very good information. And then do you take insurances?
Yes, we do. We at MHM are on almost every major insurance plan.
Okay.
And so when people come to see us, they are subject to the same co-pays and deductibles that they would be otherwise due to pay.
According to whatever their insurance policy covers.
That is correct.
All right.
I'm sorry for interrupting you, but most of the insurance companies would much rather have their patients come to an urgent care center when the urgent care center is appropriate.
Absolutely.
Because it's actually, quite honestly, it's cheaper for the patient, and it's less expensive for the insurance company as well.
Absolutely.
So it's a win for everybody.
Awesome. And I heard you opened a couple new centers recently.
Yes, at MHM, in the last few months, we opened up in River Ridge, we opened up in Mandeville, in Slidell, we opened up on the West Bank, and also in Houma. We are soon to open in Mid-City, and in Covington, and in Hammond.
Oh my goodness. How many total centers do you have now?
At this point, 12, soon to be 15.
That's great. So you're pretty much covering the whole entire area.
Yes, we are. We're trying to get a nice geographic footprint here in the metro New Orleans area.
Great. And if our viewing audience wanted to find out more information, how would they find out more information about your centers?
Well, the easiest is our website, which is myhealthcarematters.com.
myhealthcarematters, okay.
.com or mhmurgentcare.com, same website.
MHM Urgent Care, okay. This is just a very, very valuable information to our audience. Is there anything else you'd like to share with us?
Well, one thing we're specifically proud of at MHM is that we were the first urgent care company not affiliated with a hospital to become Joint Commission accredited. As you know, but I'll explain to the audience that the Joint Commission is the gold seal of approval, so to speak, for hospitals and healthcare organizations, and it is very difficult to both get that accreditation and to maintain that accreditation. But certainly when people walk in and see that gold seal, even though they may not know what it is, if you investigate it, it tells you you're at a quality organization that follows all the standards
Absolutely.
That are needed to ensure their safety.
Absolutely. So it's a seal of approval setting standards for urgent cares.
Absolutely. Well, for all healthcare organizations, but urgent cares in specific. And as I said, we were the first non-hospital-owned urgent care centers to get that designation. Very proud of that.
So when somebody goes to MHM, you know you're getting quality care.
Absolutely.
Well, thank you so much for joining us on the show, Dr. Cvitanovich. I really appreciate this.
Thank you for having me.
And we'll be right back with more Community Health Heroes.